So we have shields. So you know, we've all encountered patients who have either difficulty hearing or for whatever reason find it difficult to communicate with you while you're wearing a mask. So I use a face shield for those patients, and so that they can see my face, and I still feel safe, you know, with them. And that's worked well. You know, quite a few of our patients are hard of hearing, and failing that, you know, it's. And I also invite, if it would be helpful for them, those patients, if they would like a carer to, you know, or family member to come with them, they're invited in. So certainly, you know, the aim when we invite patients in for a face-to-face appointment is to make sure that their safety is a priority, as well as the safety of our staff. So again, you know, although each surgery be slightly different, you know, all members of staff in our team are wearing PPE when they come into contact with patients, and even when we don't have patients in the building, we're making sure that we wear face coverings to keep ourselves safe amongst each other. In our surgery, and I think throughout all surgeries here, we have, you know, changed how our waiting rooms are. Tim, as he said earlier, you know, patients are waiting in the car, but our surgery, we've created pods, you know, including screens, so that patients are 2 meters apart when they're waiting to see, you know, clinicians, and you know, they're quite safe with alcohol gel readily available. All members of staff are wearing PPE and you know, following Public Health England guidance. So that's a face mask and or a shield. We're wearing an apron. We're wearing gloves. And so we do look a little bit different. I'm having to wear scrubs now, which you know, so when I'm at work, I'm wearing scrubs rather than normal day-to-day clothing. And it's the safety of everyone is the priority. And as Tim already said earlier, we're only inviting you in if it's absolutely necessary to invite you in. But again, throughout this whole, you know, the past few months, there are patients who have needed to come in on a regular basis. Patients who need drug monitoring, you know, and that includes for the chemotherapy. We've got some really poorly patients who need regular reviews. We've managed to adapt some of our long-term condition reviews over the phone, but still blood tests are needed and blood pressure checks need to be done. So, you know, that can't be done over the phone. So we're doing that in the surgery, and again, you know, as only if it's absolutely needed.